Good evening, everyone. I'd like to welcome everyone who has joined us this Sunday evening for our Housing is Healthcare Community Forum. My name is Allison Eisinger. I am the director of the Seattle-King County Coalition on Homelessness. And it is my great pleasure tonight to welcome you all to a forum that the Coalition on Homelessness is hosting with our partners at SEIU 1199 Northwest Healthcare. SEIU 1199 Northwest is the largest union of healthcare workers in Washington State, and among the people who work in healthcare who are represented by them are the folks who work at the Red Lion Hotel-based shelter and Valley Medical Center, as well as a number of other people whom we all consider essential workers, and we thank them. I'm going to just briefly take a moment to say what I hope we are gathered to do together this evening. We are going to hear from several people who have important and unique perspectives on the issues of housing and healthcare and what the Renton community, as well as communities all over King County, can do, are doing, and we hope will continue to do to help keep our community safe from the COVID-19 pandemic and to really live the understanding that the pandemic has brought to each and every one of us, that our own health is wrapped up in the health of each other, and that there is no well-being and safety for one person or one group without attending to the well-being, the health, and the safety of everyone. We're hoping to hear a little bit about what's happening right now, as well as what we've learned from the hotel-based shelters that exist in Renton, in Seattle, in Bellevue, in a number of communities across King County, and why it's so important to help keep people sheltered during this crisis. And we'll have some time for questions and answers, and Amy will cover how to participate as a member of the audience if you're not speaking in just a moment. I'm just going to go through the agenda, which includes our first speaker, whom we want to get to quickly because she is a nurse, Corey Lucas, who works at Valley Medical Center, and she's actually taking the time to join us on her break. After Corey, we're going to hear a little bit about the public health context from Ann Burkhart, who works in the office of the director of the Public Health Department for Seattle and King County. Then we're going to hear from one of the owners of the hotel, a local business owner and employer, Ankar Dhaliwal. After that, we're joined by Rachel Feil, who is a professor at the University of Washington at the Evans School of Public Policy and Governance. And Rachel is going to share really exciting research that she and her colleagues have just published in the last week about how this intervention has been working. We'll have some time for some questions, I hope, and we're going to invite you all to do what you can to take action in support of the folks who are safely sheltered at the Red Lion and in support of a healthier and safer community for all of us. There is a city council meeting tomorrow night, as I think most of you are aware, and we'll give you some pretty quick and easy ways, including the one that's on the screen right now, for Renton residents to let their mayor and city council members know what their perspectives are, and invite those of us who don't live in Renton to share that information with our friends and neighbors who are. Amy, I'm going to turn things over to you now.
All right, thanks, Allison. Hi, everyone. This is Amy Clark from SEIU Healthcare 1199 Northwest. Thank you again so much for joining us. As Allison said, we would like to take your questions. If you have a question for any of our panelists at any time, or if you have your own experience to share about homelessness in the Renton community, please go ahead and click the Q&A icon at the bottom of the Zoom window and type in your question, and we will do our best to get to as many questions as possible. So now it is my great joy to introduce Corey Lucas, who is a registered nurse at Valley Medical Center, and she is a member of SEIU Healthcare 1199 Northwest. Corey, you have the floor.
Hi, thank you for having me. My name is Corinda Lucas. I go by Corey. I've been a registered nurse for, well, I probably don't want to admit for how long, but I've been at Valley for about 10 years. I currently work in the emergency room and the ICU, with the ICU being my home base. So March 2020 brought to the area a new crisis that has not ever been seen before. And we as healthcare workers are trained to be ready for such events. But the reality is much more foreboding than the general public can really realize. The impact to our healthcare workers has been both a mentally and physically draining process for us. We are faced with our own mortality on a daily basis, faced with insecurities of not having enough PPE. We've been concerned about the financial impact to our institutions. Definitely have been faced with loss of family time and the emotional burden of taking the place of loved ones for our patients as they navigate through a very complicated hospital stay, doing this alone. We do this with grace, dignity, and respect for the communities we serve. I can speak on behalf of the healthcare providers at Valley who serve the community of Renton that we are tired, but continue to move forward with our duty with smiles and empathy. It was brought to my attention a couple days ago that the leaders of Renton plan to shut down a functioning plan that involved placement of high-risk people of the community into single-dwelling hotel spaces that was set in motion to help stop the spread of this deadly virus. The homeless population are a high-risk group of individuals due to multifaceted issues that are not limited to the virus. Decisions to close these facilities because of public outcry and lack of understanding of why is not okay, and it basically, in my opinion, is plain wrong. The people complaining about these issues are the same people who get to go home at night and hug their families and do not have to worry about having a place to sleep. Homelessness is a systemic problem that is not going to be solved today, but choosing to make it more difficult for these group of individuals is morally wrong. In addition, closing these single dwelling rooms could have a great impact on the community health and the resources that are available to the community at this time. The second wave of COVID has hit our institution and we are at near capacity. My question to the leadership is, where do you expect the community to get care if the leaders of Renton shut down the hotel dwelling and force this high-risk group of individuals back into homeless shelters where the spread of disease can take hold and spread quickly? What is your plan to help healthcare institutions find open available beds and staff to care for your community if the hotel is shut down and people placed back into these common dwellings spread COVID quickly and then go out into the community and spread the virus there? This isn't a Seattle problem. This is everybody's problem. You as the legislators work for all the people. Your job is to ensure the well-being of all individuals. Putting people back into common dwelling shelters where hundreds of people are together is dangerous and could lead to further spread of a deadly virus in an already overwhelmed healthcare system and cause increased number of deaths as we run out of necessary resources to care for the community that you serve and that we serve. I and my fellow colleagues are not okay with letting people just die because we can't provide the care necessary to save them. Sorry, I don't mean to get emotional, but this has been a long 9-10 months. I respectfully ask you, the leaders of Renton, to reconsider your motion to close the hotel until this pandemic is controlled and you have a sufficient alternative plan in place that will allow for permanent placement of these humans who deserve to be treated with the same dignity and respect that you are afforded. I appreciate your time for letting me come here and speak on this such important issue. Healthcare is a right. It's a right for everybody. A place to live is a right for everybody, and we need to do better by maintaining these facilities for these people so that we can keep them safe, as well as the general public and my colleagues and any other healthcare workers that may be on this forum watching or listening. Thank you.
Thank you so much, Corey. Our next speaker is Ann Burkhart from the Office of the Director of Public Health at Public Health Seattle-King County. Ann, you have the floor.
Thank you, and thank you, Corey, for everything that you are doing. I know that Valley has been pretty hard hit lately, so I can only imagine how you're doing down there. So when COVID hit King County back in March, it feels like lifetimes ago, a variety of strategies were put into place, including strategies for folks who live in congregate settings to be safer. Those strategies were things like setting up an isolation and quarantine facilities, and then these hotel-based shelters that help existing shelters de-intensify or have less folks crowded together, which helps to stop the spread of disease. What I'm going to run through today, which is just the high data points about where COVID is in our community right now, the state of the pandemic, I think will show that these strategies are more important than ever. So with that, I'm going to hit some high points about the status of the pandemic in King County. And I think if there's questions afterwards, Allison said she'd follow up because we're on a bit of a time crunch. So I guess I would start by saying that we are in the winter and fall surge that we were warned of. Case counts have been increasing since September 21st, and we have reached a new peak with an average of nearly 800 new COVID cases every day. To put that in comparison, when we had the stay-at-home order back in April, we had 195 cases per day. There's been a significant increase in hospital bed counts over the last 2 weeks. And I guess it's positive news, but it's really not. The deaths remain low, relatively low in our region, with the median age remaining around 80. That being said, the increase in rates is among all age groups, but the largest proportions are among 25 to 34-year-olds and 35 to 49-year-olds. We track 8 key metrics to see how we're doing in our response and if we're bending or flattening the curve that you guys have heard about. We are not meeting our targets for 6 of those 8. The first metric is, what are the trends in the numbers of reported cases? As I just talked about, the case rates are increasing. Our target is to have less than 25 per 100,000. Our current status is 422 cases per 100,000. We look at something called the effective reproductive number. That tells us how many folks one person with COVID transmits the disease to. We want that number to be below 1. We're above 1. The risk of being hospitalized is increasing. The risk of death in our region from COVID-19 is increasing. In good news, our testing capacity is doing okay. We're able to get tests back within 2 days, which you'll remember is much different than at the beginning of the pandemic. But as we heard from Corey, we are not meeting our targets on a number of beds that are occupied. This is by non-COVID patients to make sure that there's room for folks to come in if they get ill. I will say the healthcare system is working to address this, and we are seeing some positive notes or positive improvements, but we're not quite there. But we are, in some silver lining, below our target for how many folks are in the hospital with COVID-19. So while this is, for me, discouraging and a little scary, I will channel Dr. Duchin when he tells us that we do know how to flatten the curve. We've done it before, and we can do it again. We need to stay home when we can. We definitely need to stay home when we're sick. We need to wash our hands. We need to socially distance, and we need to wear our masks. And we can come out of this, but it is transmitting at a very concerning rate throughout our region right now.
Thank you, Anne. Next, we have another speaker, but before I introduce him, I just want to remind everyone that we do want to take questions. If you have a question, please use the Q&A chat that's available if you just click the Q&A icon at the bottom of your Zoom screen. Type in your question there. That's how we're taking questions. Now we will move on to hear from Onkar Dhaliwal, who is one of the owners of the Red Lion Hotel. Onkar, the floor.
Hi, good evening. My name's Onkar Dhaliwal. I am one of the owners of the Red Lion Hotel in Renton. I would like to thank DSC and the participants of this forum for including Pintu Bath and myself in this conversation regarding the homeless and the shelter in Renton. Pintu and I have owned this property for almost 7 years now. We have always seen it as our civic duty to give back to our local community. We have made annual donations to Children's Hospital, local food banks. We've even hosted the Renton Police and the fire fundraisers at the Red Lion. With this mindset, when the opportunity arose to help stop the spread of COVID, we naturally said yes. This was met with strong opposition from the City of Renton officials and the Chamber of Commerce. They asked us not to renew the lease with King County, or we will deflect future hotel business to your property. The Chamber of Commerce also said we are running an illegal business by not having a business license. We did not lease the hotel to drug dealers. We leased the property to King County, who is saving lives by housing our most vulnerable population during a pandemic. The Chamber of Commerce and the Renton City officials have made it clear that homeless are now infiltrating downtown core or going through dumpsters, jaywalking, and stealing. Since 2014, Pintu and I have had to deal with homeless people entering our hotel on a regular basis. They live under the 405 interchange and walk to our property to use our bathroom, wash up, or try to sleep in our stairwells. Many times we had homeless ask if they could just change their clothes in our bathroom. As a business owner, I would love the opportunity to be able to suggest a local shelter to get a shower, a bed, and a meal. I believe an overnight shelter in Renton is long overdue. The Renton city officials are now rushing a new ordinance through to close the shelter during a pandemic. I think the City of Renton officials and the Chamber of Commerce need to understand that homelessness can happen to anyone. They should not dictate how many nights a person can stay, or the number of homeless individuals, or where in society a homeless shelter should be located. How a society treats its most vulnerable is always the measure of its humanity. I request that the Chamber of Commerce and the City of Renton officials stop targeting the Red Lion. Instead of seeing the shelter with resistance and fear, I request that they choose this opportunity as a time to learn, change, and grow together. Our elected officials should tour the facility and understand DSC's vision. I also encourage the Chamber of Commerce to continue the bi-weekly meetings that they're having with Noah Fry and the local Renton community. I find it dehumanizing and against our civil rights to say that a certain class of individuals can occupy my hotel, but the homeless may not. I mean, today, the City of Renton officials are saying you cannot have a guest stay more than 30 days. Tomorrow, are they gonna tell me I can't pump more than 5 gallons of gas at a gas station? I believe it is the elected officials' responsibility to make sure all are treated equally, no matter the person's circumstances. I actually go to the hotel on a daily basis. I am met with gratitude from the residents saying, thank you for allowing us to stay at your property. And Pinto and I, we own the building and we are collecting rent. I give all the credit to King County elected officials and DSC for making a positive impact in people's lives and allowing a real change to occur for their future. Thank you.
Thank you, Ankar. Again, we are happy to take questions. If you have questions for any of the panelists or for DESC staff, you may click on the Q&A icon and type in your question there. Now we will hear from Rachel Feil, who is Associate Professor at the UW Evans School of Public Policy and Governance. Rachel, go ahead.
Hello, thank you for inviting me. I am here to tell you about some research that I have had the privilege to work on over the past 6 months or so in conjunction with some other colleagues at the University of Washington and also a team at King County Department of Community and Human Services. And this research project, we just published a final report, and I will put the link to the report in the chat at the end of my presentation, so you will get even more detail there if you're interested. But the goal of our research was to evaluate this experience of moving folks from congregate shelters to hotels during the pandemic. And I want to specify that our research is not only about the Red Lion, but about multiple hotels across multiple providers during this time. So we had, during the transition, several providers who were operating congregate shelters, traditional shelters, that were moved to 5 or 6 different hotel locations. Sorry, I know that's in the report. I don't have that specific number in front of me. We spoke with residents at 4 of the different hotels, as well as staff from 3 different providers, the City of Seattle and King County. The reason we undertook this research is because we started hearing very early after the change, after the move of shelters to hotels, of all of the positive benefits of this move. So this was something that the staff, both in the provider agencies as well as in the local government, began to hear anecdotally, that this change from shelters to hotel spaces was transformative for many of their residents. And so we put together a research team, and we had some fortunate partners who helped fund it, the University of Washington and the Gates Foundation, and some in-kind support from King County, to take a systematic look at what it meant to do this move. And so the team at King County looked at what happened from a quantitative standpoint. So they have all the data around who's in what place and what did that mean. And specifically, they looked at the relationship between the moves from traditional shelters to hotels and how that was impacted and how that affected COVID or COVID outbreaks. And what is clear from their findings, from our findings, is that after the move to hotels, we see many fewer outbreaks. We see actually no outbreaks of COVID in the hotels. There were some isolated cases here and there, but no outbreaks, compared to some of the shelter spaces that remained more traditional shelters, although still with increased protocols, there were continued outbreaks, and it continues to be a challenge. So you can see the specific data on that report in the you'll be able to see the charts and the data, but what we clearly found is that the move from shelters to hotels reduced the risk of COVID among those experiencing homelessness. Now, what was even, so that I think that was the purpose of the intervention, and it clearly worked from that perspective of reducing COVID. However, we also looked into and found that there were additional positive health and well-being outcomes that came from this move of traditional shelters to the hotel environment. So I will review a few of them, and then for more details and quotes from the residents, you can find, and some of the staff, you'll be able to find that in the report. The first thing we found were increased feelings of stability associated with access to a private room. People reported just feeling better, that this was a big improvement from their prior state, and actually feeling a little bit reduction in the chaos of the lack of permanent housing. We also heard repeatedly about improved health and well-being. And a lot of this was associated with having regular sleep, uninterrupted sleep, time to, if they needed a break, time to take a break, as well as regular meals. So feeling that mental health and physical health was improved from this move. We heard a lot about reduced interpersonal conflict and the benefits of moving to a hotel space where it was a lot easier to de-escalate any type of conflict or any tension among residents or between residents and staff. And this is something we heard about both from the residents and the staff, that traditional shelters can be a very chaotic place where people don't have much of an opportunity to kind of take a time out if they need it or want to have some time for themselves. But because hotels offer that opportunity, the general feeling is one of more peace and lower conflict. We looked at some quantitative data to correspond with that, specifically related to 911 calls and with fire department and dispatch, and police dispatch. And because of some data complications, we don't have perfect data there, but we have heard in the Seattle locations, so this is outside of Renton, I just want to be clear for this particular finding, is in the Seattle locations, that post this move from shelters to hotels, there was a marked reduction in 911 calls associated with the sites housing those experiencing homelessness. So this is an overall finding about the system, but when we look at the system and the 911 calls associated with where folks experiencing homelessness are housed, we saw a reduction of those 911 calls after the move to hotels, which further supports what we heard about the reduced interpersonal conflict. We also heard residents talking about an increased focus on the future and an ability to actually think about gaining housing, employment, and education, often recognizing that we're still in a pandemic, but feeling like they have time to organize their thoughts and make plans going forward. And we also saw in some of the quantitative data, higher exits to permanent housing and more engagement with the staff. So through some of the program data that the King County folks have access to, we saw that those in the hotels are working more closely with the staff and more successfully to work towards ending their homelessness permanently. So I will be happy to answer questions, and I will go ahead and post that link in the chat. Thanks.
Great, thank you, Rachel. As Rachel said, she's happy to answer questions. If you have a question for Rachel or for any of our panelists or for DESC staff, please click the Q&A icon in your Zoom screen and type in your question there. Allison, turning it over to you.
Great, thank you very much. I want to thank each one of the speakers who joined us. Such remarkable perspectives and important insight into what is actually happening in the midst of this pandemic, namely that despite things being genuinely hard and us going into a winter that realistically we have every reason to believe will be harder, we are seeing that there are interventions that work. And I want to recognize that that doesn't mean that things are without difficulties. And in fact, one of the questions that we got is something that I will answer as best I can, and we'll see if we can have additional amplification from people. Sorry, I'm seeing lots of things come in through the chat and the Q&A, and so I want to make sure that I'm not missing anything here. So one of the first questions that we got was, I believe, from a local pastor who does work with people experiencing homelessness who are in Renton, and Pastor Casey Hahn. So thank you very much for joining us. And the pastor's question is about how have the DESC staff who are staffing and supporting the 235 guests at the Red Lion Hotel Shelter interacting with other Renton-based homeless service providers and service providers. And I can share the information that I have from the housing manager at DESC, Noah Fay, at DESC, who is, as Mr. Dhaliwal noted, meeting on a regular basis with any interested parties at meetings that are facilitated by the Renton Chamber of Commerce. The folks at DESC are interacting with Reach Renton, with Valley Medical Center, with Renton Police and Fire Departments, and they're actually, whenever possible, taking referrals from those sources. We know that there is some good work happening in Renton. There are both shelters for families with children, some places for people to get meal service, as well as the Renton Vet Center, which is permanent housing for formerly homeless veterans and their families. That's run by Compass Housing Alliance. So there is good work that's already on the ground in Renton, and I think connections have been made by the DESC staff with all of those. As to the matter that Pastor Hahn noted, there have been some changes made to the proposed ordinance, but the proposed ordinance would drastically curtail both the current activities and, we fear, future services for people experiencing homelessness in Renton. So as on behalf of the Homeless Coalition, what I will say is we really are encouraging the mayor and the city council to drop this proposed ordinance as something that really is not conducive to the kind of regional problem solving that many folks have acknowledged they believe is the actual appropriate response to the crisis of homelessness. And certainly in the context of this pandemic, we know that we have over 7,000 people throughout King County who aren't even fortunate enough to be in shelter at all. And so we certainly, while we're working hard to increase the options that are available for them, need to not lose the shelter that does exist, that is working well. Amy, I may ask for your help just to make sure that I'm not missing things, but I think I will move on to a question that I saw that is particularly for Ankar Dhaliwal, and I will just briefly paraphrase it just to shorten it. But the question is for you as a business owner to talk a little bit about how the business community in Renton and in other parts of King County might be part of the solution. To follow the example of you and your business partner, and to really recognize and respond to the fact that in this crisis, we need to see solutions that local business owners, as well as social service providers and first responders and healthcare providers, are able to offer. Do you have any thoughts about that from your perspective?
Yeah, of course. I think, especially during a pandemic, you know, I mean, just like what we're doing now in this forum, I believe community has to come together. And I think that, you know, obviously the way that for some reason it's been portrayed is King County is coming in, leasing his property, and the city of Renton is not working together. And I think, I'm a resident of Renton. My business partner is a resident of Renton. We have a business in Renton, and I believe people of Renton, they want to help out the homeless community. So one thing I was going to ask Noah was, make sure that it's, where people can see where they can do community, outreach by whether they want to make donations for the homeless people. I know winter is coming, everybody needs things. And then they can work in that kind of environment to make sure that this is successful. I know that, there's a lot of businesses, like I said myself, where I've experienced homeless people coming to my property and then I have nowhere to direct them. I know that in the past, the Renton police, sometimes, if they'd have a person that was in trouble or needed a night to sleep something off or whatever it was, they would ask, hey, can we rent a room? And I saw the Renton's police department paying for that. So I can tell that there's a need for an overnight shelter. So I think other businesses, they will think that, they will see this as an opportunity for everyone.
Right. Thank you very much. I also want to share with you all a little bit of the perspective of someone who is staying at the Red Lion. And we were offered a sneak preview of a beautiful essay that I understand is going to be published tomorrow morning in Crosscut, which is the online news source. And this is an essay that was written by someone named Mark, who is currently staying at the Red Lion. I'm not going to read the whole thing to you, but I think it's particularly important that as we're having this conversation and inviting people to contact elected officials about the immediate issue, which is this proposed ordinance, as you've heard from Ankar, and as you understand if you've taken the time to join us tonight, these are issues that require all of us to step up and be part of problem solving and community response that recognizes that we really do depend on each other's actions to keep ourselves safe during this crisis, and really at all times. And yet, it's very important that we not simply talk about people who are in the Red Lion taking shelter there, but bring some of their voices in. So I thought that I would share with you a little excerpt from this essay, and also to recognize some of the information about who those 235 folks are. You heard our nurse, Corey, talk about people who are at high risk for contracting COVID-19 and at high risk for having really serious disease if they do contract COVID-19. And that's because a number of the guests at the Red Lion are older adults and people who are living with disabilities and with chronic health conditions, such as diabetes, heart disease, COPD, and asthma. And these are underlying conditions that we know puts anyone at risk of serious complications or even death due to COVID. My understanding is that at this site in particular, in addition to all of the other services that are available on site that support individuals in their path towards health and recovery and strength, there is 3 times a week COVID testing. And in fact, since March, only 3 people have tested positive at the Red Lion Hotel for COVID. And those people have been supported in the isolation and quarantine facilities that King County has stood up to help people in our community when they need somewhere other than the hospital to go. That's quite extraordinary when we think about the 550 unique individuals who have been safely in that hotel-based shelter. And I have to share with you that a colleague of mine, just before we began this conversation tonight, gave me information about San Diego, where they've set up a congregate shelter in their convention center because they are so desperate to try to provide somewhere safer for people to be. And they've just had an outbreak of 55 guests and staff infected with COVID-19 just in the last 2 days. So just to underscore that what we have here is working, and we need to keep it working and also figure out how to get more of what we know works. So here's just an excerpt of what Mark, the guest at the Red Lion, has written. I look around and see so many people doing so much better than when they came in. Taking up exercise, eating well, feeling safe, having dignity restored, and becoming part of the Renton community. Where will we go if this place is shut down? Where will I go? This hotel has been so important to me and the people I know. We don't want to face an uncertain future. At the end of the day, if this facility closes down and we're forced to vacate, I'd have to scramble to start over, to find suitable accommodations, somewhere I can feel safe and warm. It would be absolutely devastating to me and all of the residents. There are homeless people in Renton, and likely more people becoming homeless every day here. Where are they going to go? I'm so thankful and appreciative of the neighbors who've shown support for us and the community who has embraced us. I think COVID-19 has made it hard for us to share that experience so that more neighbors can see that everyone deserves a place to call home. This has been one of the few bright spots of this year, that the Renton community came together to support people experiencing homelessness. I appreciate this, and I hope Renton will continue to welcome us instead of turning us away in our moment of need. Before we move on, and I think we do have time for a few more questions and answers, I do want to share with you how, if you are a Renton resident, you can communicate that sentiment or your own version of it to Mayor Pavone and to the members of the Renton City Council between now and their City Council meeting tomorrow night, Monday at 7 p.m. We have created a very simple action link for people to send an email, and in fact, we recommend that this is sent by folks who are Renton residents. So if you are, we invite you to use it and to personalize it with your own specific perspective. And if you're not a Renton resident, we invite you to share that link with your friends and colleagues and neighbors who are. And then there is an opportunity to offer public comment to the Renton City Council during the meeting tomorrow evening. And the way to do that is also on this slide here, to email the city clerk at rentonwa.gov. And in fact, the best thing to do is to do this by 10 a.m. tomorrow morning, Monday morning. Just include your name, the fact that you'd like to offer public comment, and your email address, which of course they will get from your email. And if you need any kind of support or have any questions as you're preparing your public comments, the Coalition on Homelessness would be very happy to offer whatever assistance we can. You can send us an email at speakup@homelessinfo.org. And what I will do as we are fielding some additional questions and hearing perhaps from some of the speakers who were able to stay on with us is I will just recognize you if you've had a chance to use this action alert to take action. And if you're not a Renton resident, please do put in the chat what you think you'll do to support people in taking action in this very short time frame. Thank you so much for sharing that slide, Amy and Kenya. Let's see here. Patrick from DESC, thank you so much for joining us. Great. So we have some DESC folks who are ready to answer questions. We really appreciate that.
So Allison, right now, it looks like we just have one more question. Of course,
Yeah.
We can take additional questions. But one guest asks, if this ordinance passes, is there a deadline for when people would have to move out of the Red Lion shelter?
Right. Well, I think actually that might be something that we need to have somebody from DESC confirm. My understanding is that just in the last few days, there were some edits made to the proposed ordinance. And I want to be careful because I have not worked my way through all of them. But my understanding is that the closure would be at the beginning of June in 2021. And then there are some other constraints about what would be possible to set up after that. But again, because this is moving so quickly, and I am not a land use specialist, I want to just alert people to the fact that that's my current best understanding. The trouble being, of course, that what we need is we need far more shelter than we currently have all across King County. And there is no way of knowing when this pandemic will end. And there is no way of knowing when we will have a better alternative place for people to be. I see a couple of comments here from Maggie Breen, who is with Reach Renton, and who says that that they were interested in seeing if they could have access to some space, and that it wasn't possible for DESC to offer rooms. So I'm going to acknowledge that and guess that indeed this is the challenge that we all share. You may have heard me say earlier.
I can speak to this a little bit.
Rachel, please go right ahead.
Sure.
Yeah, thank you.
Just as part of the research, we spoke with the staff at King County and at the City of Seattle about the process for the move. And all of these moves were based on COVID risk. So they evaluated the existing highest density shelters that were currently in the King County system, and then asked those were, the goal was to mitigate COVID risk as quickly as possible. So I of course am not on the, was not on the back end of that, but I know that the motivation and move was made based on which shelters were identified as having the most people and the most people crowded together, and the most people who were what was known at that time high risk in terms of COVID, so primarily in terms of coexisting conditions and age. And so that was what was the motivation for moving. Obviously, it's been a long time since then, but I could just offer that insight because it was something we specifically were curious about, or how these decisions were made for some shelters moving to hotels.
Yes, thank you so much, Rachel. If I'm understanding Maggie's comment correctly, I think that the concern was also, of course, there is a need for shelter. There's a great need for shelter. Actually, early in the pandemic, I went to the one of the community meal sites that exists in Renton. And of course, one can understand that people might see this is a new resource. As Ankar said, as a local business owner, he has long wanted there to be somewhere where he could usefully refer people to. The problem is that congregate shelters, including a number of shelters that were located in South King County, in Kent, in Federal Way, that Catholic Community Services operated, they actually also had to move from what were congregate settings into hotels. And in fact, I think over 1,000 people moved at least once in order to be in safer locations, and sometimes even those locations turned out to be places that weren't able to maintain enough distance between people. And so the work in Bellevue, in South King County, in Seattle was enormous and important, and still left thousands of people without any shelter at all. So while we are working very hard to try to maintain what is working here, we know that there is still enormous unmet need. And that is one of the challenges, is that this shelter is the best that we have right now, and those folks count themselves quite lucky, I think, compared to others. I want to just double check. I think, yes, thank you, Nicole, for confirming that the bill as currently written notes that the deadline that the Renton electeds are attempting to create in this zoning code change would drastically reduce the number of people in the shelter after June 1st, 2021. So I hope that we are going to be able to have additional conversations. This is something that we are committed to continuing to do, to listen and share information. And I will say that the Coalition on Homelessness, SEIU 1199 Northwest, and the speakers who joined us today are united in our commitment long term. We are not new to these issues. We are not new to the fact that homelessness has been a crisis throughout our region, and the pandemic has laid bare many inequities and many injustices, including the fact that we don't all experience this crisis with the same levels of risk. And the fact that we can and do respond in ways that will actually be very effective if we are able to keep it up. It is a very difficult time for so many in our community, across the region, and across this nation. And we all are sincerely hopeful that we'll be able to keep the communication going, improve on it, and really commit to each other. We are certainly an advocacy organization that works to support our member organizations in the good work that they do every day and every night, but also to advocate with local government, with regional government, and with state and federal governments to ensure that the resources are there to support all of our health and well-being. We will be very glad to follow up with people to make sure that we're getting the information that that you're asking for. And I hope very much that you will stay in touch with us, and that we'll be able to gather, if not in person, then in electronic form, both tomorrow evening and beyond then. And I want to thank very much everyone who took the time to attend, all of the speakers, our co-hosts at SEIU 1199 Northwest, and hope that you all have peaceful evenings. Thank you so much.